Thank you for watching videos 1, 2, and 3. Now that you have a pretty good idea of how the skin heals, let's take a look at a few photographs that will demonstrate common post-treatment concerns of your patients. I'm hopeful that we can all work together, therapists and clients, on the next videos by showing actual photos of our patients with a clarification of what these visual effects really are, and then recommendations will be made to help remedy these appearances. Here's a patient a few days after electrolysis treatment with redness and a lumpy appearance. This is completely normal. If you advise the patient of this appearance beforehand, you will alleviate their concerns and make your own life a lot easier. Indeed, the hallmarks of inflammation are swelling and redness. The medical term for swelling is edema. The medical term for redness is erythema. In the below photo, you see normal but exaggerated edema and erythema from electrolysis. The photo on the right shows the side of a face with beard removal. The area was cleared and the skin has become swollen hard. While unpleasant, this effect is of no lasting consequence. This effect can be avoided by not clearing close together hairs. If you want to avoid this, thin the area, don't clear. This photo shows what looks like tiny pits and some scabs. What you are seeing is the pull-down effect of the myofibroblasts and some edema of the surrounding tissues. This pitted appearance is most common on the upper lip, the upper cheeks, and the chin, and it's temporary. Notice that you can also see tiny pits in the untreated areas. Here's what's happening. The sweat glands, which are tiny tubes in the skin, look like pits because the surrounding skin is swollen around them. Of course, patients seldom notice this and only focus on the treated areas. This client will completely recover with no lasting sign of treatment. This photo is a classic and shows the ordinary post-treatment appearance on toes and fingers. These red dots show up especially well on very white skin because there is a greater color contrast. Dark skin never shows red dots. So here's what's happening. After the tiny scabs have fallen off, in a week or so, the angiogenesis, that is, the mass of new capillary loops, is showing through the thin epidermis. There's absolutely nothing to worry about. On toes and fingers, this often progresses to hyperpigmentation, but in every case, every one, this completely resolves. The person in this photo will have perfect skin. The photo in the foreground is a bikini area, right on schedule, 2 weeks after treatment, that shows angiogenesis. Again, very visible on white skin. Although patients get alarmed, this appearance is nominal. You are only seeing the normal healing process through the skin. Do not panic. This is the normal healing process taking place. Sadly, not all post-electrolysis manifestations are temporary. The marks you see here are on a man's shoulders. I have named this problem pebbling because the tiny mounds of scar tissue look like pebbles. As I will explain in a forthcoming video, this permanent mark is typically caused by using the current too low. Yes, really, too low. And then having to treat the regrowth over and over. The repeated injury causes a buildup of scar tissue in the follicle, and it ends up looking like a pebble. I hope you've enjoyed this presentation. Now I need your help. If you are a patient, or an electrologist, or even a laser person, please send me photos of anything you are seeing or are concerned about that deals with your treatment. In the next videos, I plan to talk about everything, all the post-treatment concerns patients have. A plastic surgeon and a dermatologist will examine your photos, and the answers will be technically correct. Of course, your photos will be anonymous. please send your photos to my email address. And many thanks to the wonderful patients who have allowed me to use their photos. All of this can help each of us achieve our goal of perfect skin. And thanks again.